Hi, I'd like to talk to you about the cost of healthcare. If you're like many of us, we're looking for different alternatives to help compete with the rising monthly premiums and the higher deductibles that we're facing. I'd like to introduce you to AlieraCare Premium, individual and family healthcare that you can afford. AlieraCare is the only ACA alternative plan nationally. It's one plan that comes in a two-part offering. The first half, the direct primary care medical home, provides things like your preventive care, your doctor visits, telemedicine, and your RX discount coverage. The second part, the Unity Healthcare Sharing Ministries, provides things like hospitalization, surgery, emergency room, specialty care, and maternity. And because of that partnership with the HCMS, they're not limited to the open enrollment windows, so you can adjust your coverage at any time. Unity HealthShare is a recognized HCMS under the ACA guidelines, and because of that, we have to change some of our terminology. MSRA is Member Shared Responsibility Amount. You can think of this as your deductible. Monthly contribution equals monthly premium. Member share amount is your coverage. Quick note, the member shared amounts have a lower negotiated cost for services. Need is your medical expenses for medical services by a licensed practitioner. Eligible needs are costs incurred under the provided service after the effective date. Your medical eligible needs are reimbursed through an escrow account that collects monthly contributions. And the nice thing is, with Unity Health Shares, they issue checks directly to the provider out of that escrow account. All of the AlieraCare offerings are ACA Exempt Plans. You'll receive the 8965 tax exemption form, so you won't have to worry about the ACA penalty. All of the AlieraCare offerings come in 3 different AlieraCare categories, each with its own member shared responsibility amount that you can choose from. There's the AlieraCare 5000, AlieraCare 7500, and the AlieraCare 10000. AlieraCare has 3 different offerings to fit everyone's individual needs. And remember, with each offering, you can choose the member shared responsibility amount that you're comfortable with. With the value plan, it covers the 63 preventive care items listed by the ACA. It gives you telemedicine, an RX discount plan, hospitalization, surgery, and emergency room coverage. The Plus plan covers you for the same 63 preventive care items, your telemedicine, RX discount. It also now includes labs and diagnostics, 3 doctor visits, 1 urgent care visit, hospitalization, surgery, and emergency room care. With the Premium plan, you get the 63 preventive care items, telemedicine, RX discount, labs and diagnostic, but now you get 5 doctor visits, 2 urgent care visits, chronic care, podiatry, OBGYN, and your hospitalization, surgery, emergency room care, specialty care, and maternity. So before we go into the details, let's go through a quick example how the AlieraCare offerings work.
In today's society, we are always on the run. We are your first line of defense for your healthcare needs. Call Teladoc first before you do anything. With Teladoc Telemedicine, you can quickly speak with the healthcare provider, either face-to-face, through a computer or tablet, or call and talk to a provider over the phone. The best part is, there's no consult fee or copay, and it's available for you and your family. Teladoc can treat many healthcare issues, including small wounds, allergies, headaches, colds or flus, rashes, bronchitis, fever, nausea, skin inflammations, pink eye, and many more. Teladoc providers are able to prescribe a wide variety of prescription products. Your prescription medication could then be picked up at your local pharmacy. So now you can get healthy, happy, and back to your normal hobbies. In this segment, we're going to talk about Aliera Healthcare's free concierge service. At Aliera Healthcare, we understand it's hard to balance work, life, and your healthcare needs. That's why Aliera Healthcare provides a free concierge service for all members. This service is to help guide you through your healthcare needs. Call Aliera Healthcare to set up your appointments. When you need help locating your provider's office, or if you have a general question about your membership, our professional healthcare team at Aliera is here for you. It's time to wrap up our How to Use Your Health Pass membership video. Let's do a quick review. Use Teladoc Telemedicine before scheduling an appointment with Aliera Healthcare. It's the quickest way to speak to a healthcare provider. If a Teladoc provider is unable to resolve the issue, contact Aliera Healthcare to schedule an appointment. Aliera Healthcare thanks you for watching this video. We are excited to have you on board.
And last but not least, we have the AlieraCare Premium. It comes in a 5,000, 7,500, or 10,000 MSRA, and it's also in the First Health PPO network. It's a two-part offering. The AlieraCare offering covers you for the 63 preventive services outlined by the ACA. There's a zero out-of-pocket expense and no deductible to meet for any of the scheduled preventive care services or routine in-network checkups for things like a pap smear, flu shots, and more. It's always easy to stay healthy with regular preventive care checkups. The plan also covers you for telemedicine. Whether you're sick at work or in bed all day, a doctor is only a phone call away. Talk to a doctor on your phone or video chat and have your problems diagnosed and even medicine prescribed. With 24/7, 365-day access to a doctor, staying healthier has never been simpler. The plan also includes a prescription drug program. The AlieraCare Prescription Savings delivers significant discounts on both name brand and generic drugs, saving cardholders an average of 55% on their prescription drug purchases. We're increasing the amount of doctor visits you have, and we're also including chronic care visits. With the AlieraCare Premium plan, you can also receive chronic care management for conditions such as diabetes, asthma, blood pressure, or cardiovascular conditions. You now have a total of 5 doctor visits that you can use throughout the year. The plan also gives you over 180 labs. We're increasing the amount of urgent care visits to 2. Your plan also covers you for x-rays. Another added benefit is children can receive care from a pediatrician and women can receive care from an OB/GYN. The only limitations are that your annual physical is available after 9 months. A consult fee will be due when a member visits a provider, on average about $20, and members are responsible for a read fee of $25 on average for x-rays when they visit an urgent care facility. With the Unity offering, your hospitalization, inpatient and outpatient surgeries are covered once you've met your MSRA. You get emergency room coverage with an even lower MSRA of only $300, and now we're including specialty care. So if your primary doctor needs to refer you to a specialist, there's only a $75 MSRA that's due. Maternity care for natural childbirth is also included with up to $5,000 of sharing available. If there's an emergency C-section that's needed, there's up to $8,000 of sharing available. And if there's complications after the child's birth, there is up to $125,000 of sharing available. The per incident sharing is also going to be increased. There's up to $500,000 per incident sharing available with a $1 million lifetime cap. Now that you're familiar with the new terminology, let's go through Unity HealthShare's Statement of Beliefs. At the core of what we do and how we relate to and engage with one another as a community of people is a set of common beliefs. Members agree to abide by these statements of beliefs. 1. We believe our personal rights and liberties originate from God and are bestowed to us by God. Number 2, we believe that every individual has a fundamental religious right to worship God in his or her own way. Number 3, we believe it's our moral and ethical obligation to assist our fellow man when they are in need according to our available resources and opportunities. Number 4, we believe it's our spiritual duty to God and our ethical duty to others to maintain a healthy lifestyle and avoid food and behavior or habits that produce sickness or disease to ourselves or others. And number 5, we believe it's our fundamental right of conscience to direct our own health care and consult with physicians, families, or other valuable advisors. AlieraCare Health, in partnership with Healthcare Sharing Ministries, have created an ACA Exempt Plan for individuals and families. This combination provides the most flexible and cost-effective program on the market today. Feel free to download the plan detail sheet, which goes through all of the AlieraCare plans and benefits and sharing amounts. At the very bottom of the sheet, it goes through the pricing for individuals only, individuals plus spouse, individuals plus children, or family coverage. If you would like to enroll in one of the benefits, or if you have questions, feel free to contact us at www.alierahealth.com/Jose Sanchez. Again, that's www.alierahealth.com/Jose www.alierahealth.com/Jose Sanchez.